So, hello students and welcome back to the clinical anatomy series, the case discussion of upper limb number 6. ठीक है बच्चों, तो हमने ये क्लिनिकल एनाटॉमी का सीरीज शुरू किया है इन विच वी डिस्कस द केसेस and how to approach a clinical case and the questions which are associated with this case. I'm sure, not hope, I'm sure that you've seen the previous clinical case discussions and you are able to follow them. Yes, and now we come to this clinical case discussion number 6. Have a look at this. A patient uses crutches improperly and develops wrist drop. ठीक है, तो crutches use कर रहा है, wrist drop हो गया, plus sensory loss on the dorsolateral radial hand, dorsolateral aspect. यहाँ पे dorsolateral aspect पे sensory loss हुआ, क्लियरली मेंशन किया है, दे हैव क्लियरली मेंशनड इट. क्रचेस ले रहे हैं, हाँ, मतलब उसको कुछ फ्रैक्चर हुआ होगा या फिर कुछ एक्सीडेंट हुआ एंड अ पर्सन इज यूजिंग क्रचेस. सो बिकॉज ऑफ द प्रेशर ऑफ द क्रचेस इन द एक्सिला, एक्सिला में प्रेशर आता है क्रचेस का, विच इज द नर्व विच इज इन्वॉल्व्ड. यस, पोस्टीरियर कॉर्ड इन्वॉल्वमेंट होता है. द नर्व इन्वॉल्व्ड इज रेडियल नर्व, रेडियल नर्व इन्वॉल्वमेंट होता है, राइट. सो व्हेन अ पर्सन यूजेस क्रचेस तो रेडियल नर्व कंप्रेशन होता है, रेडियल नर्व इन्वॉल्वमेंट होता है. वेयर? अभी क्रचेस कहां पे है? क्रचेस तो एक्सिला में जाएंगे ना, तो वेयर इज द रेडियल नर्व इन्वॉल्वमेंट? इन द एक्सिला. सो व्हिच नर्व इज अफेक्टेड? क्या लिखोगे? रेडियल नर्व. रेडियल नर्व की इन्वॉल्वमेंट है. हाँ, वेयर इज द लाइकली लेवल ऑफ लीजन? तो लीजन कहां पे है? एक्सिला. एक्सिला में लीजन है. क्लियर है ना? सिंपल है. दे हैव मेंशनड इट इन द क्वेश्चन में ही मेंशन किया. तो पेशेंट इज यूजिंग क्रचेस, तो क्रचेस कहां पे रखते हैं? क्रचेस आर जनरली पुट इन द एक्सिला एंड देन द सपोर्ट इज टेकन विद द अपर लिम्स. So nerve affected, radial nerve. Where is the likely level of lesion? In the axilla. Okay. अब पहले तो you have to understand the branches of radial nerve. Radial nerve के branches समझ लो, so everything will be clear to all of you. Everything will be clear. So starting with the radial nerve. Radial nerve. So radial nerve is the continuation of which cord of the brachial plexus? बोल सकते हो, it's a continuation of, या फिर branch बोलो या continuation बोलो. It's a continuation of posterior cord, right? Posterior cord of the brachial plexus की continuation है radial nerve. What is the root value? C5 to T1. C5 to T1. So radial nerve is the continuation of posterior cord. उसका root value है C5 to T1. C5 to T1. So what are the branches of radial nerve? Radial nerve gives number 1 in the axilla. एक तो axilla में branches देती है, दूसरा spiral groove में देती है. Second is in the spiral groove. Spiral groove. So number 1 is in the axilla, number 2 is in the spiral groove. So इसको कैसे याद रखोगे बच्चों? Very simple way to remember this. Axilla में radial nerve gives 2 muscular branches and 1 cutaneous branch. 2 muscular branches, 1 cutaneous branch. 2 muscular branches to the long head and the medial head of triceps. Long head of triceps and medial head of triceps को branches देती है axilla में. 1 cutaneous branch, that's the posterior cutaneous nerve of arm. Posterior cutaneous nerve of arm. So बस ये फ्लो चार्ट्स याद रखना. If the radial nerve is injured in the axilla, everything is gone. पूरा जाएगा ना, entire जो भी radial nerve supply करती है, everything will be gone. So what are the branches of radial nerve in the axilla? कैसे याद रखोगे? 2 muscular branches, 1 cutaneous branch. Cutaneous branch मतलब sensory branch, skin. So 2 muscular branches to the long head. 1 is to the long head of triceps and दूसरा है medial head of triceps. 1 cutaneous branch जिसका नाम है posterior cutaneous nerve of arm. Posterior cutaneous nerve of arm. In the spiral groove, again we get, अब इसको कैसे याद रखोगे? तो यहाँ पे 2 muscular, 1 cutaneous and 1 एक एक ऐड करते हैं. So this becomes 3 muscular and 2 cutaneous branches. 3 muscular and 2 cutaneous branches. So 3 muscular branches to 1 to the lateral head of triceps, second to the medial head of triceps, lateral head, medial head, and third is to anconeus. So 3 muscular branches, one is to the lateral head of triceps, second is to the medial head of triceps, and third is to the anconeus. ऐसे याद रखना, यहाँ पे 2 1 एंड 3 2. 2 cutaneous branches. Cutaneous branches क्या होंगे? One is the posterior cutaneous nerve of forearm, posterior cutaneous nerve forearm, and second one is lower lateral cutaneous nerve of arm. One is the posterior cutaneous nerve forearm and the second one is lower lateral cutaneous nerve of arm. याद है बच्चों, upper lateral cutaneous nerve of arm is a branch of which nerve? Axillary nerve, right? Upper lateral cutaneous nerve of the arm is a branch of axillary. So axilla में 2 muscular, 1 cutaneous branch. Spiral groove में it gives 3 muscular branches. Spiral groove के ऊपर कौन है? Lateral head of triceps. नीचे कौन है? Medial head of triceps. So lateral head, medial head, and the nerve which supplies the medial head वो जाके supply करती है anconeus को. So the nerve which supplies the medial head of triceps also supplies the anconeus. So 3 muscular. 2 cutaneous branch, one is the posterior cutaneous nerve forearm and the other one is the lower lateral cutaneous nerve of arm. Lower lateral cutaneous nerve of arm. Perfect है? Is this perfect? So बच्चों, medial head of triceps को 2 बार nerve supply हुआ. Look at this. The medial head of triceps receives nerve supply twice. Once in the axilla, once in the spiral groove. Why? Because medial head of triceps is the largest head. सबसे बड़ा head है triceps का. Medial head of triceps is the bulkiest head, largest head. So 2 बार nerve supply होता है. One in the axilla, once in the spiral groove. Fine है? Now coming to the third. So first axilla में branches दिए हैं, फिर spiral groove में branches दिए हैं. अब coming to third, lateral aspect of arm. Lateral aspect of the arm. So lateral aspect of the arm पे radial nerve gives branch to brachialis. Brachialis को branch देती है lateral half of brachialis. Medial half of brachialis is supplied by musculocutaneous nerve. So lateral half of brachialis को supply करती है. Second is brachioradialis and third is ECRL. So lateral aspect of the arm, the radial nerve supplies the brachialis, the brachioradialis and the extensor carpi radialis longus. अब half of brachialis को supply करती है, lateral half. Medial half of brachialis को कौन supply करता है? Musculocutaneous nerve. Right? It also supplies the brachioradialis and ECRL. The main muscle which causes extension at the wrist is extensor carpi radialis longus. This is the main muscle जो extension करता है wrist पे. If this ECRL is damaged, अगर इसको damage होता है तो what do we get? A wrist drop. We get a wrist drop. If extensor carpi radialis longus is damaged, we get a wrist drop. Fine. So that's about on the lateral aspect of the arm. And last is in the cubital fossa. In the cubital fossa. So in the cubital fossa, the radial nerve gives final 2 branches, last 2 branches. One is a superficial branch and the other one is a deep branch. Deep branch का दूसरा नाम है posterior introitious nerve. So last मतलब radial nerve पहले axilla में branch दिया, फिर spiral groove में दिया, फिर lateral aspect of the arm में दिया, and finally the radial nerve comes in the cubital fossa. हमने देखा है ना, radial nerve is a content of cubital fossa. Medial to lateral content क्या है? Medial nerve, brachial artery, tendon of biceps, radial nerve. So radial nerve, yes, it's a content of cubital fossa. It divides into a superficial and deep branch. Deep branch का दूसरा नाम है posterior introitious nerve, right? So this posterior introitious nerve supplies all the muscles on dorsal aspect of forearm. So posterior introitious nerve is going to supply all the muscles on the dorsal aspect of forearm. The superficial branch is cutaneous. ये cutaneous होती है ना, sensory होती है. The superficial branch is cutaneous. It goes below the brachioradialis. It is sensory. It supplies the skin on lateral 3.5 fingers. Lateral 3.5 fingers, the dorsum and the proximal phalanges को supply करती है ये superficial branch of radial nerve. So superficial branch of radial nerve supplies, it goes below the brachioradialis. It lies in the roof of anatomical snuff box and then it supplies the skin on the dorsum of the hand and proximal phalanges of lateral 1, 2, 3.5 fingers. Fine. So that's how you understand the complete radial nerve. But I hope in brief I've explained you the radial nerve. अगर details देखना है तो lecture जरूर देखना. Radial nerve का lecture आप जरूर देखिए. This is in brief. I've told you an idea about the radial nerve. So radial nerve gives 4 sets of branches in 4 different areas. One is in the axilla, second is in the spiral groove, third is on the lateral aspect, and fourth is in the cubital fossa. ठीक है, तो ये है सारा radial nerve. And yes, questions देखिए. So which is the nerve affected? Radial nerve. Likely level of lesion is in the axilla. Why is the triceps involved? Yes, अगर radial nerve ऊपर injury होती है, so the entire muscles which are supplied by radial nerve are gone. So triceps is involved. Yes, why is it involved? Because it is supplied by radial nerve. Triceps को radial nerve supply करता है, right? And name the branches of radial nerve. तो मैंने आपको branches सारे दे दिए हैं. So branch in the axilla, branch in the spiral groove, lateral aspect, and cubital fossa. I hope this is clear to all of you, बच्चों. तो आज का MCQ आपके लिए, बच्चों previous clinical cases भी देखना. हाँ, just see the previous clinical cases also. तो धीरे धीरे we are starting from the brachial plexus, then axillary artery, we are coming to the axilla, we are coming to the arm, and अब forearm की तरफ आते हैं हम. Fine. तो आज का clinical question, आज का clinical MCQ for you. Radial nerve is a branch of which part of the brachial plexus? Simple है. अगर आपने ये पूरा लेक्चर देखा है, समझा है, you will definitely be able to answer this MCQ. Radial nerve is a branch of which part of the brachial plexus? Answer this MCQ in the comment box. And बच्चों, let me know your comments whether you are able to understand this. ठीक है ना? In short, I have explained this radial nerve. Details के लिए आप लेक्चर जरूर देखना. So comment box में लिखिए whether you are able to follow or no, या और कुछ भी extra चाहिए आपको. Thank you so much, बच्चों. Thank you so much for your patient listening. I hope things are clear to all of you. Thank you once again. Bye-bye.